So welcome to another episode of the AI Leader. I'm Chris McFadgen, and as always, joined by my co-host Andy McMahon. Andy, how are you getting on?
Very good, very good. I've had
Nice to
a
see you.
fun day of Teams meetings, the usual, but it's good. Good to be
Yeah,
here.
not often you're in the
Excited as
office
ever.
when we
I
do
know.
these.
Well, I'm in a few days a week now. A few days a week now. It's good. It's a good space.
A bit of change of environment for you. We're not joined by Ishbel today. She's on family holiday. I spoke to her last week. But we are joined by the Chief Operating and Data Officer of Talking Medicines, Elizabeth Fairley. Elizabeth, great to have you on the show. How you doing?
Really good. Very excited to be here. Thank you very much for the invitation.
Great.
And so excited to talk a little bit more about all that we are doing in AI and that machine learning and modeling space. So it's exciting.
Superb. Yeah, we're very interested to hear. So we thought we'd, as we typically do, we give you the kind of the floor to begin with to let us know a bit about yourself and your background, a little bit about what your role is, and to find out about talking medicine. So over to you, Elizabeth.
Hi, yeah, no, great. So Talking Medicine, so we're a data tech company. We are based in Glasgow, and we also have some of the team in London. And we also established ourselves in New York a couple of years ago. So fantastic to be out there too. What we do is we use our modeling and AI technology to really surface up data intelligence from conversational data.
Yeah.
We are dedicated and have been working only within the healthcare sector. So we know this space really well in the sense that it's complex, it's highly regulated, and also it's challenging to surface up that intelligence from conversational data of how patients speak and how doctors speak because it's a hugely challenging, complex space. But we've been working in this space for years. And so we've got some very cool tech that enables us to classify large volumes of data into whether it's a patient talking or whether it's a doctor. And then we can also go in and start to kind of put hooks within the data to say whether something's a medicine, a symptoms, or a feeling. And then the output of that we call curated data. And then we also use large language models, which obviously have accelerated massively in the last couple of years, to be able to extract out the intelligence back to our customers. The customers are primarily out in New York, so we're working with healthcare advertising agencies, but we are very close to the delivery back into pharma. So we do a lot of work with the advertising agencies, but working very closely with that delivery back to their client, which is the pharma. And with regard to my role, so yes, as a founder with Joe Halliday and Scott Cray of Talking Medicines, it's certainly busy. We've got a hugely talented team. We're very fortunate to have a lot of talent within the data tech side, very strong on the marketing and life science knowledge. Quality and ethics is very, very important to us as well, and we've put that right at the core of the business. So there's just over there's around 35 of us in the team. So a number of them are annotators that are involved in creating that gold standard training data that we use to train the models and to get the very high the high accuracy that we have. And then we've got a number within the core team that are working across marketing, sales, a high number within that data tech, and obviously quality and compliance as well.
Amazing. Amazing. Myself and Andy were talking about the business yesterday, and we looked at one of your products, DrugGPT, and obviously kind of assumed that was following on from the evolution of ChatGPT over the last couple of years. But obviously, as the business been called Talking Medicines, have you always been analysing conversational data, even post the sort of evolution of LLMs in the last couple of years?
Yeah, I think that's a great question. So Talking Medicines, it is the company name is what we do. So we bring medicines to life through understanding more about those conversations around medicines. Obviously, it goes broader than medicines. So we've started and put medicines at the core because we're commercially driven. But we're also very keen to use data for good, driving better outcomes to patients. So that's very much at the core of the business. And so with that, we've done that in a number of different ways. So when we started, we had more kind of app technologies that were engaging between with patients or healthcare professionals, that we were gathering information around how to take medication, or how to direct the taking of medication. And we were collecting that data and using it to understand and the value of it. And then with our customers, actually, we scaled into understanding more about that conversational space within social media. And that obviously we couldn't do just by more traditional rows and columns, bringing in data and saving it and using kind of data analytics. That's really where we had to start to build the power of the modeling technology to be able to structure such vast amounts of data, and to be able to classify it to that rich source of patient and doctors and how they're speaking about medicines. And then that's evolved further by working a lot more with customer data. And that can be website content, it can be transcript data. It's essentially all of the kind of more free text places, unstructured data that customers have that is highly insightful and really informative and very rich in its value, but it's difficult to structure in those more traditional ways, because it doesn't neatly fit into a database, and that's the power that we bring to it with our modeling technology.
Super interesting. So the area you're in, Elizabeth, I assume that kind of aligned with your background, just from having a quick skim, of like your LinkedIn and stuff. So that makes sense. Has it been a challenge kind of going into an industry that, is regulated and is sort of, is tightly controlled, and one where the outcomes are very serious, obviously, like you said, you're trying to do right by patients. I work in financial services, obviously heavily regulated, and that brings its own challenges, but its own opportunities. Can you talk about that?
Yeah, I think for us, when we started, and we were working with patient data, we were coming through a regulatory change with GDPR. And I think that really helped us because we put it right at the center of the business. From Joe, Scott, and I's perspective, we've always, governance and ethics and high quality standards, it's always, we're very aligned there. So I think that kind of helped us in some ways because we put it so far in the center. And obviously, because we were working with patient data, we had to be, very, very careful about how we were processing that data, how we were saving it. We're very high on that PII side, and understanding how to really be on top of kind of that data processing from a regulatory perspective. I think that's also now helped us in the sense that we know what pharmaceutical companies are looking for. So we know, with working with advertising agencies, we know what their clients, their pharmaceutical clients are looking for, and that can really help them, I think, in the sense of how to shape or how to help them, especially in the evolving field of AI. We can kind of start to go through procurement with them and helping to understand how we explain all that we're doing, and the way in which we've built all that we've done. We've built it in a way that is can be used within that highly regulated environment. One example is within the product, DrugGPT. So an important aspect for pharmaceutical companies is the fact that the data comes in and is saved behind a data vault. So we receive the data that can come in lots of different formats, highly unstructured. And then we structure it and we pass that through the modeling, and that data we call curated data. And it's that curated data that sits behind the product in a data vault. And then when you're asking questions using DrugGPT, it's only pulling from the data that's in the data vault. So it's not
Mm,
linking to the web, or it's not pulling from any other information. It's very secure within the data vault. And also because we've done all of our training, we've done so much there. We're not using any customer data for training. So we keep the worlds of R&D and kind of the surfacing and
mm.
delivering back to customers, far apart in that perspective.
Yeah. Well, it's good to hear that the way you've sort of described that, because sometimes when I speak to, fellow techies and fellow people in this world who are not in a regulated industry, they think it's just something to slow you down. But I actually think it drives a lot of innovation,
Yeah,
because the stuff you're
absolutely.
talking about there, your data vault stuff, the data controls, the governance, and all of that, that's all stuff you have to solve through a combination of process, people, technology. And I think it's easy to just think it's all a constraining thing, but actually it drives you to innovate and do very smart things, which is great to hear.
Yeah, and I
So
think we've
that's
also been really had our eye on our IP and how to protect that. So,
mm,
we've got 2 patents filed. We've got a number of publications. So I think, and then we've also got a number of governance bodies that we've put in place, that are specifically focusing on quality, so that if there are anything that we need, which is a tiered process of how we kind of assess and mitigate risk. But we've also got one dedicated to um, more around data privacy and security. And then we've got kind of one that is overarching governance body. So I think we have taken it very seriously, in the sense of in a good way, because it means that although we're a growing, scaling business, we can actually play in a much bigger arena. So, we're,
mm,
through procurement with big pharmaceutical companies, large healthcare
yeah,
agencies. So I think that all helps. I think it's one that's really important. It doesn't really matter what size you are, you've got to be
yeah,
mindful of your regulatory and compliance and ethics, of how you're doing things.
yeah.
You
Good.
mentioned it.
And we've mentioned. Oh,
Oh,
sorry, Chris.
you.
I was just going to say we've mentioned obviously DrugGPT a few times and AI. Let's sort of dive into that. So generative AI, LLMs, all of that stuff. You're obviously embracing it, making it part of your offerings. Has that been a big challenge? Has it lived up to the hype? And then kind of how are you thinking about this as the technology evolves? So just kind of, what's Talking Medicine's view of the Gen AI wave and how you're embracing it and how you expect it to evolve into the future?
Yeah, I mean, I think for us, it's been a fantastic opportunity. One of the challenges that we had with structuring, so, we're very strong there on that classification and structuring of data with regards to bringing out, that what, how we do that to provide that curated data. One of the challenges was how to draw the insight from all of that structured data. And that's where the large language models have been fantastic. So we're currently licensing GPT from Microsoft, and we've optimized it to work on our healthcare curated data. So, that's where, and we're very close to, how that works with regard to giving
Mm,
text responses to questions, summarization of data, and then
yeah,
we're beginning to kind of push the boundaries there on more that visual representation. And so we continue to kind of build on that capability, but we're also looking, I mean, there's so many large language models. We've got a number that are in our kind of R&D pipeline, but we're
yeah,
also kind of keeping a close eye on others that are kind of coming up. But I think that's what makes us different to others as well, because it's not, we haven't started with the large language model and then thought, oh, how do we then
yeah,
kind of scale
yeah.
this? We've kind of started with a solid foundation of data science, you know, healthcare and life science expertise, and then we're using the large language model to extract out. So we will go
Yeah.
to wherever we think is going to give us the best result for that data intelligence extraction. And currently it's working well, but we're also looking at other large language models. We often get asked as well, are you going to develop your own? And there's so many there. It's like, and that technology moving so fast, as you just mentioned, it's like, you know, it's that the piece for that's the kind of piece for us that's the icing on the cake, as it were. So we'll just, you know, we're quite keen to just see what's working really well, and then use that,
Yeah.
and then make it more dedicated to our use within healthcare.
Yeah, no, makes sense. It's really funny you said that about training your own, because it's ridiculously expensive and compute intensive and very technically challenging. So I think people
Yeah,
underestimate what that actually means.
absolutely.
And there's also, you'll be probably interested in this or maybe know about this, but there's sort of interesting results where you see that the third party provided LLMs outperform some finely tuned large language
Yeah.
models on specific data sets. So for example, GPT-4 outperformed Bloomberg GPT on financial data, also outperformed MedPAM-2, the Google
Yeah.
medically fine-tuned LLM on medical questions. So it's like, if you've got that off the shelf, why would you why would you burn all your runway sort of trying to do something that might not work? So it makes a lot of sense.
Yeah,
Do
and I
you think
think
to that
we're
point there's a big education piece? Oh, sorry. Do you think
oh,
there's a big
sorry, no, on you
education
go.
piece? Yeah. Do you have to teach your kind of customers a lot about these technologies and what they mean and how they work, just to sort of make sure you're all on the same page?
I think there definitely is that, because people see, you know, they see ChatGPT and then they're like, you know, and large language models working, and there's a lot that then that expectation is that, you know, I can ask any question, I can get a very quick response.
Yeah.
And so there is definitely an education piece there. You know, I mean, we drive to give an increase in productivity to our customers. And we do that time and time again with an 80% uplift. And the way in which we do that is because the amount of kind of manual process and analytics, and it's still sophisticated to some extent, the kind of data science that's being performed, but it takes a lot of time for the customers. So with the modeling technology, we can just give that lift, that then they have more time to kind of look at the data in a way that is really informative. So I think that uplift is really important to us, and communicating that over to customers. And I think often we find that once we have customers onboarded, we see time and time again, they're like, oh, this is amazing. You're giving us hours, days, weeks back. So that is a real win for us. But there is that challenge as well, or that slight reminder to at times that, you know, we can be dealing with very complex questions from the industry, and within a healthcare sector, it can be very challenging to understand, okay, you know, how do we optimize that diagnosis and management of treatment for a patient? So some of the complexity and the sophistication around some of the questions that were asked, you then need to think, okay, this could take some time to come back. It can't always be returned in 20 seconds. So I think that's where we also have to do an education piece. And so we kind of run both in parallel at the moment, where we give some ways that are very quick responses, balanced with more of a deeper dive, where we, you know, especially when we're working with profiling of authors or looking more about a specific subpopulation, or, you know, within a population, and how they are connecting with healthcare and taking medication. So when it gets very complex like that, we tend to kind of use that more deeper dive route. Same technology underneath, but we just take the time to really get that intelligence of accurate and highly valuable to the customer.
Yeah, that
Just one
makes a lot
point
of
from
sense. I
me.
think the education piece is always, it's always the hard bit. It's like,
Yeah,
well, this is what we can
exactly.
actually do, not just, what you've seen in a demo or online or had a play with on your phone. This is, we're building it for a specific use case with specific constraints. Here's how it works. So, it's always a challenge.
And I think it's really interesting to see some of the bigger players as well, that they're really leaning into different, more sector specific AI, which is interesting. AI is such a big, it's such a big world, but such a big word. I think that's where it's kind of leaning in. We've been working in that space for years and
Yep.
with the modeling technology, and now it's all under that AI kind of bubble. But actually, I think there is more that we can do there to really help on being more, we're very specific to healthcare. So, just communicating that more within that space can be really useful, which is why it's great to be keeping an eye on how regulation within AI is changing. But for us, being right at the front within healthcare, how can we build that into our practices? How can we communicate and educate and work more with the sector, as well as, as well as, all of our customers and clients as well.
Just lastly from me, Elizabeth, on the product itself, is that a software as a service model subscription based that you offer it to your customers? The DrugGPT.
Yeah, the drug. Yeah. So we offer that in a number of different ways, actually. So the subscription model is definitely the ideal for us.
Yeah.
But we have been moving more actually in we're keen to pursue more partnerships with customers, and so moving more on to 2-3 year kind of opportunities with customers, which definitely moves us into a completely different lane with regard to kind of really drawing out that data intelligence that they're really needing long term. And there's also huge value in using DrugGPT as a tracking product, in the sense that a lot of what is being done today tends to be completed and then moved on to the next project. So the value of using DrugGPT is that you can run data through it, and then you can run more data through it and do a comparison in a month's time or next quarter or year to year. So we could be working with conference data, for example. So running that over a longer period of time and seeing that change is very, very valuable to customers. So we're certainly keen to kind of steer customers into those longer term partnership opportunities. And also within, back to a point that you just made about large language models and the fact that we're so strong on the depth of our modeling, the large language model sitting on the top, and that is reflected in the cost as well. So, we're not at the lower end cost, we're, mid. So that also leans into longer, more established opportunities.
Spot on. You obviously touched about you've got a presence in London and New York recently.
Yeah.
Obviously, healthcare and healthcare advertising is huge in the US.
Yeah.
How has it been kind of growing the majority of your technical and data team in Scotland and kind of that process over the years, and then having a big bulk of your market share being abroad?
Yeah, so I mean, New York has been fantastic for us. We've been really welcomed into the sector. We've got we've been award winning in the last couple of years. It's been fantastic. To come into a market and within a few years to be so established has been incredible, and we're being recognized, but also people are so complimentary, which is fantastic. And I think they see we're different coming as a data tech team, technology company coming into that space. I think especially the timing around AI and all that is happening within that kind of creative and advertising space. I think we're really nicely positioned. So we spend a lot of time out in the States. And we work really hard to bring all that energy and enthusiasm from our customers and from that sector back, to make sure that the whole company is part of that journey. We obviously have, we a number of the team have been out in New York as well, which has been great. So they can kind of see it through their own eyes. But I think it is a really important aspect of building the right culture within Talking Medicines. I think we put a lot of energy into that piece. With regard to talent, we're incredibly lucky in the sense of Scotland and the UK. There's just so much amazing talent when it comes to data science and AI. And I think it's not easy within healthcare. But it's great to see that, we've got some incredibly talented individuals within the team that are, rapidly advancing their career by working with us, which is fantastic to see. And I think the blend of the fact that we're at the front, so it's exciting. We're also delivering a product that is, that we're growing, scaling, and it's got all the aspects that you would expect within a stable product. And we're also, we've got, the data for good is a very important part to our journey as well. So I think it not only attracts people, but also retains people within the team, which is great.
Yeah.
I couldn't agree more. Just interestingly, as you've been growing, especially more recently, when you're looking at data scientists, do you look for experience in large language models or even a healthcare background? Are you quite open? Have you built a team that's got a diverse kind of background and skill set?
We do. I think having an understanding, we're always encouraging people that are interested in working with us, and we're always open to top talent. So approaching us for opportunities.
Feels like I'm plugging in the recruitment side here.
Exactly.
Sneak that one in there, Chris. That was good.
No, it's just really when I recruit, say for instance for Andy or stuff or banks, it never really matters the industry that they come from, especially in data. So the main expertise is always kind of last in the priority list. But it's just interesting. Well, obviously LLM in healthcare, didn't know if that would be different.
I think it does make a difference. So we see a difference for people that, take the time to research what we do, understand where medicines fit in. And I think a lot, in fact, I think, we've got there is probably, if we looked at the team, I think healthcare, it touches on us all in some way or form, but I think because of what we do, it brings it more to the forefront, and I think it does drive a different culture within the business, and in a good way. And I think, so I think people can see that because they can relate to personal experience. So even if they're not, we're not looking for people that are experts in kind of healthcare analytics as such, because like you say, those if you're very, very good, you can transfer them. But I think if you understand, or you've had that experience of understanding what, in some ways, how doctors are connecting with patients and how patients are going through that diagnosis and treatment, that makes a big difference when you're then analyzing the data. You can, because a lot of it is bringing out the intelligence to to make a change, or to bring that to the surface to the pharmaceutical companies where language maybe is not resonating or is resonating, to make a difference to drive better outcomes.
Yeah, that makes a lot of sense. We kind of we touched on this a bit, but I want to come back to it. You've built and grown this company from Scotland, and it's a real sort of success story for the Scottish sort of ecosystem and what's going on. And there's a few things happening like that. I know you're based in Barclays Eagle Labs, and there's there's GigDI, there's Streamba, there's lots of great companies sort of emerging, and the talent that's here, the potential of the ecosystem seems to be sort of growing, which is great. in your opinion, what are we getting right, and then what could we do better? So that's kind of a big ask, right? But I think someone with your experience of doing this and really making a success of it with your co-founders, right? People want to hear this. Like, what is Scotland doing right, and what do we need to do to sort of keep growing and like really take over the world, basically?
I know, and I think it's such a good question. And I think, as Scotland, within life science, it's strong within, data tech. Like you say, there's some amazing companies building. There's been some incredible successes as well. So, and I think, that from those successes, bringing that expertise and kind of more investment opportunities back to support those that are scaling and growing is really, really important. And I think there's a number of communities, and I think finding the right community to support companies is sometimes a bit of a challenge through the number of kind of, supporting communities that there are in Scotland. It's fantastic that there are so many, but then that can be overwhelming, I think, at times as well. But I think finding that can be fantastic because everybody's so open to helping others. So we're certainly very keen if we can help others on the journey. We've had a lot of support and help from people as well, which has been fantastic, and companies. You mentioned there of what we can do more of. I think we've been very aware of always having our eyes open to the bigger opportunities. Having one foot in the US, I think really does make you look at the world differently. Whether it's the US or it's somewhere else, I think that really helps. And I think you can see as well that the journey that others, that seemed quite we knew we had to make that step a few years ago. Now that we've made it seems, we want to help to encourage others. The piece around, I think when you're scaling and you're so agile and you're moving at such a fast pace like we are, I think one area where there could be value is to understand how some of the bigger, more established corporates could be closer. So I think there is definitely something in that of bringing that ecosystem closer together. So there's very good around companies that are our size and are in similar stages, but essentially, you want to be around businesses that can you can learn from their operation efficiency, you can learn from their potential investment opportunities. They can help you, and also there could potentially be that exit opportunities as well. So I think really building that, and that's a difficult thing to do in Scotland because we we don't have so many of the big players. So just making that happen, I think doesn't necessarily need to be within each sector. It's maybe thinking about it across sector. So, how could a big financial player help us, for example, or how could, I think we could learn there from each other actually. And I think that would be something that would be really interesting to kind of, to kind of set in motion a little bit.
No, I mean, amazing points. I think it's really insightful. Well, you never know. You guys might be the next big corporate that has, I look forward to the Talking Medicines Innovation Fund and you're funding all these startups in the ecosystem. That could be the future. But I think it's such a good point, and sort of the way you've described the community there is exactly what I've seen and experienced through working here. But I do agree there is something that has to happen around just supercharging that ecosystem because it's such potential, right? Such amazing talent, amazing universities, like you said, really deep vertical knowledge in certain domains. It's just how do we supercharge that for a relatively small country? How do we take advantage of all those resources? So,
am I right in saying, though, health tech in Scotland is one of our biggest emerging markets in terms of the per investment capital, and also for both grants probably as well, government investing money into that as well. It's been really performing well. There's been a few different businesses over the last few years, isn't there, that's taken off?
Yeah,
Yeah.
definitely. No, I think Scotland is has always been strong within that healthcare life science sector, and
Yep.
so it's just, and there is, I mean, there's a great bedrock of investment, and also established businesses. But
Yep.
I think it's just figuring out how we have that blend. But I think that is special to Scotland as well. I think I can see that we've got the right components. It's just about how you supercharge it. Mm.
Yep.
My
Great.
last question was just based around, obviously we've seen LLMs like kind of shake up or really fast track your product and its offering. Where do you think AI will continue to evolve and disrupt potentially healthcare or pharma markets
Mm.
moving forward?
Such a good question. So I think, and we've touched on this a little bit on this in this session, but I think it's such a big area of AI, and I think there's an awful lot of conversation around large language models and how they're going to be used, and the kind of pros and cons actually of the use. I think about how AI will really disrupt and improve patient engagement and outcomes, like to really transform the industry. I think it is coming, which is so exciting to see. But I think we're starting on that path. So I
Mhm.
think, but I do think that through the use of modeling technology and the use of the large language models, we will see a drive of an improve, that increase in effectiveness and efficiency, being used to, in that healthcare delivery
Yep.
kind of lane, and that will be super exciting. But it will take time. It will take just to, like we've talked about, because of the challenges around compliance, regulatory, ethics.
Mhm. Yep.
But I do think it's a really exciting time, and I think again, if we kind of lean together and figure out how we can work
Mhm.
together within this space, I think it would be super exciting to see how we can really make a difference to driving, into that predictive space. And we're certainly very excited about kind of looking to that around, disease management and
Mhm.
treatment, and how we can use, a predictive modeling in that space. And I think many others are looking there as well. But I
Yep.
think it will be collectively that we'll get there. But I think
Yep.
it's our time. I think you can see it coming more and more like stronger around healthcare, which is very exciting.
Amazing. Well, I think that's all we've got time for. But Elizabeth, it's been brilliant to have you on. Very insightful around the business and how you guys are using AI. So yeah, I hope you enjoyed it and hope
Thank you so much.
yeah,
Thank
great to
you.
meet you, Andy. All right. Thanks
Toodle.
again. Cheers.
Thank you.